Okay, video number 3. We just talked about some of the tests that can be used. What does that research identify? Who does that research identify as being at risk? Older adults, the poor, patients with limited education, minorities, and patients with limited English. Those patients who are identified as having lower health literacy are more likely to have chronic conditions, less likely to manage them effectively, and have less knowledge of their illness and its management. They also, as mentioned before, experience more preventable hospital visits and admissions. They're more likely to report their health as poor when compared to patients with higher health literacy or more proficient health literacy. Several strategies that you can use to improve health literacy. I'm going to cover four of them. You need to improve the usability of health information. Is it appropriate to the users? Is it easy to use? Are you speaking clearly and listening carefully? You need to keep in mind the demographic, the behavior, culture, attitude, the literacy skills, the language, the socioeconomic status, the access of services to your intended audience, and tailor your teaching, tailor your health literacy activities specific to that patient. Determine what their greatest obstacles are and speak specifically to that, and see if you can improve their health literacy and help keep moving them up the ladder toward more proficient health literacy by focusing on some things like that. You also need to use an interpreter if needed. You have to make patients comfortable, speak in their native language or the language they're most comfortable in, to sign informed consents, to sign permission to treat, to sign discharge instructions. If you give them discharge instructions about how to administer Tylenol and Motrin to their infant, and they don't understand, it's not in their native language, they're unlikely to be able to comply with the things that the information that you shared with them. Not because they're non-compliant, but because their health literacy is low. They haven't even been given the chance to try to understand that if it's not in their native language. Ask patients open-ended questions. We should do this anyway, but say, tell me about your problem. What do you think may have caused your problem? Don't just say, well, how long has this been going on, and so your ankle hurts, right? You need to let them tell you what's going on. Then check back for understanding. Let them repeat to you, okay, so what signs are you looking for infection? When will you know to come back, come back and seek treatment? Tell me how you're going to give your child Tylenol, or tell me how to administer your diabetic medicines. Make sure they understand. Have them say it back to you in their own words. Second strategy, improve the usability of health services. As much as we'd like to be paperless, we are not yet paperless in any facility that I'm aware of. You still have your history forms, insurance forms, informed consent, their immunization records, test results, directions to the lab or the pharmacy, instructions pre-procedure, hospital discharge and home care instructions, all are on paper. We need to make sure these papers are easily readable by patients. They may need revised. There's actually specialists who read those papers and say this is not user-friendly. Revise them as you need to. Use them in like kind of a test group, and get feedback from those patients to see what kind of changes need to be made. They need to be available in multiple languages. You could maybe offer assistance to complete forms. Help them schedule follow-up care. Make that phone call for them. When is it going to be best for them to see their primary provider for follow-up? Would they like to see them in 2 weeks? Do they want us to help call them? What location are they going to be seen at? Make sure they have a map. Ask if they have transportation. So improve the usability of those health forms and instructions. Make sure they understand that they need to be NPO before they come in for certain procedures. Third strategy, build knowledge to improve decision making. Improve the access to accurate and appropriate health information. I know that my own doctor has a patient portal that you can log into. You can see test results. You can see your medical history. You can see the medications you've been prescribed. And they encourage patients to log on to the portal themselves. They may not have internet access. They can always use the library. Everybody is allowed to log on. every patient is allowed a log on. And then talk to the educators within your own department to maybe revise pamphlets or obtain pamphlets that are easy for patients to read, to give to patients when you tell them that they have high blood pressure, or how to, the signs to look out for a stroke or a heart attack, things like that. Make sure that they're easy to read and have them available for patients to hand out. Those pamphlets should have just bulleted points, not a bunch of fill information. Patients don't tend to read that anyway. So some bulleted points for them just to look at. It's easier for them to read. They're more likely to read it if there's not an abundance of information. Last strategy, advocate for health literacy improvement. Make the case for improving health literacy like I'm doing now. Maybe you are brave enough, you'll talk to your management and say, we need to include health literacy in our mission statement, in our planning. Establish some accountability for health literacy activities, set yourself some goals, and reevaluate those goals in several months' time and see what you've accomplished and what you still need to work on, and maybe revise the goals if you need to. We've just got to take this seriously and try to improve patients' health literacy. So if you take home points, improved health literacy improves patients' understanding of how to manage their health. It increases the use of preventive services. It decreases unnecessary hospital visits, decreases healthcare spending. It improves patients' overall health. And ultimately, it makes your job easier. It's a win for the patient. It's a win for us. We're all responsible for improving health literacy. And I hope that you have enjoyed the presentation. I'm happy to take any questions. Thanks.